3, 2, and 1. All right, hello and welcome everyone to the Friday update with Mendocino County Public Health. My name is Cameron Brown, and for today's schedule, we have Dr. Andy Coren, our county health officer with us. He'll give all the latest updates for public health, COVID, MPOX for the county. We also have a special guest, and that's Dr. Janine Miller and Karen Lovato, both from the Mendocino County Behavioral Health Department. And we'll get some updates from them about mental health, suicide, et cetera, in the county. And then we'll go in and take questions from reporters and the public as well. So it's a pretty full agenda, so let's jump right in. Dr. Coren, I'll hand it over to you.
Thank you, Cameron, and everyone, welcome. Today I'll give updates on monkeypox, or MPOX as we're now calling it, COVID, influenza, and other respiratory diseases, and finally some environmental concerns. For the MPOX update, as of September 14th, we have seen over 57,000 cases worldwide, 22 deaths, which is less than the 1% expected. It's actually 0.04% mortality rate from this illness. In the United States, we've had 19,465 cases reported and no deaths. Next slide, please. In California, we have had, I guess we don't have the slide from the SharePoint. Okay, so let's go back. In California, we've had 3,897 cases, which is a rate of 9.7 per 100,000 population. We've had in California more than 100 people hospitalized. 4 children have been affected. And now we have several confirmed cases in Northern California, Humboldt, Shasta, Sonoma. And in Mendocino County, we've tested 14 and have only had 1 confirmed who has been treated and is now doing well. Statewide wastewater surveillance is also confirming a decline in the detection of MPOX. Vaccine availability has improved, but still not at the point that it is being recommended for primary prevention. Next, I'm going to move on to COVID update. We are finally seeing a decline in COVID cases and hospitalizations, and this is confirmed also by wastewater studies in California. Compared to earlier in the pandemic, and this is a slide on the left, Mendocino County has decreased closer to the levels we remember having last spring. And if you remember the old blueprint, we're now in tier 3, or the red tier. That's the expanded view on the right slide. And we have also progressed from the CDC highest transmission level to medium, and our community levels, considering more hospitalizations, is now very low. The data from Mendocino County shows as of September 14th, test positivity is down to 6.3. Is there another next slide? I think this is summarized. Yeah, here we go. And daily new cases is down to 9.4 per 100,000. The highest number or age group is in the age group between 12 and 17-year-olds. And also the Native Americans and Hispanics in our community have had the highest disease burden consistent with the social determinants of health. We have 2 people currently in the hospital for COVID, but earlier in the week, we were having no people in the hospital. So this is a little bit high. Deaths confirmed in Mendocino County from COVID now number 136. We currently have 1 outbreak as of September 15th. It's relatively small and coming under control. The schools reported in the last month of being open, 33 cases over the last month. None of these were epi-linked, and so these are not considered any outbreaks. When we look at future projections, while COVID is decreasing now and may remain controlled this fall, COVID is now estimated to be here to stay. It's projected to continue as the 3rd leading cause of death in the United States. This slide shows more what the projections are and forecasts. How it affects us will be based, will vary based on the viruses themselves, the new variants, and our vulnerability. So On the horizon are two new variants, BA4.6 and BA2.75, each a little more contagious and a little bit more partial escape from current vaccines and past infections, but they do not appear to be urgently a threat at this time. So this slide shows the black dots are the actual numbers of hospital admissions. And the colored part of the slide are the forecasts. The bottom green, yellow-green is a forecast based on us getting early boosters, which we have, and there being the same variants, no changes in variants. The next line up, which is pink, shows early boosters, which we have, but there would be a new variant, and that does show an increase, not nearly as high as it has been. And then the other two projections were based on later boosters and a new variant, and late boosters and a more severe variant. Let me see. So the other main variable besides the variants that our projections depend upon are our vulnerability. With all of the vaccinations, boosters, and prior infections, we as a population have developed a high degree of immunity, and that helps us keep the pandemic in check. So this slide, again, is showing a forecast. The dots are the actual numbers of cases through the beginning of September. And then after today, you see a blue line, which is a composite of many different projections. And it shows a sort of plateauing at this point and actually falling in October, and they can't predict further than that. There is another projection that shows an increase, but that one is in a minority. And so the composite is that dense blue line, and it shows that we probably will have a good couple of months, and that's what people believe right now. Let me see. So we have improved now, an improved bivalent booster, and this targets the ancestral variety, just like the old vaccines and boosters did, but they've added a Omicron BA4-5 variant antigen to that booster. So I think there's another slide about what recommendations there are. These new boosters are approved and are recommended for everyone over the age of 12 years old, at least 2 months after their last dose of the primary series or their most recent booster. The safety profile is exactly the same as prior. It's very excellent. And the efficacy is excellent for the prevention of severe disease, hospitalization, and death. And at least for the next several months, they're expecting also this to be effective in decreasing the case numbers. But as you know, and we've learned over the last year, the vaccines are much more effective in keeping people out of the hospital and keeping people from dying. But there is a waning of immunity that allows people to become sick, though not severely sick, with all the vaccines. So that's to be expected. While both Pfizer and Moderna have been approved, Moderna production has been delayed and the stock is very low. However, these are equal vaccinations in other respects, and they're interchangeable. So if you've had, for example, Moderna as your primary series and even boosters, you can get the new Pfizer bivalent booster at this time. What's important is to get these vaccines as soon as possible to prevent a severe surge in the fall. There is no reason to wait. We're expecting approval, in addition, of this new booster for the younger age group, those under 12 years old, soon. We also hope that these boosters will prove to be effective for at least 6 months without more boosters than every 6 months, but time is going to tell. So for those eligible for a booster, do not wait. CDC Director Rochelle Walensky estimates that we can avoid 100,000 hospitalizations and 9,000 deaths this year if we are vaccinated at a high rate. So these vaccines are available at OptumServe here in Ukiah at the fairgrounds and through our public health offices in Ukiah, Fort Bragg, and Willits. They're also available in all of the rural and FQHC clinics throughout the county. And Department of Public Health is holding several clinics in conjunction with tribes and community-based organizations. You can register now on My Turn for these boosters, and your vaccine provider will know which one is appropriate. This is a summary of what is available for vaccination. From 6 months to 5 years old, we now have the vaccines, and everyone should get their children vaccinated. From 5 years to 12 years old, vaccinate and boost, and the only one authorized for this age group is Pfizer, an 18 plus years vaccinate and boost with either the Pfizer or Moderna. Unfortunately, next slide, please. There continues to be a very low uptake in children under 12 years old, which leaves them more vulnerable to acute COVID, as well as symptoms of long COVID that we're just appreciating. In the last 2 years, the CDC data shows that COVID has been either the fourth or the fifth leading cause of death in each age grouping under 19 years old. So this slide just simply shows in Mendocino County how few vaccines have been given in the under 5 age group, and how we lag behind the state in the 5 to 11 and the 12 to 17-year-old age groups. Testing remains essential to identify upcoming threats, and the technology here is improving with better individual tests, genome testing, which we've been familiar with for the last 6 months or more. And now wastewater surveillance is coming online, and we hope to see that soon in Ukiah as well. Because conditions have changed, the CDPH recommendations have changed. So testing of asymptomatic employees and visitors will no longer be required on the 17th of September, tomorrow. Workplaces should continue tracking vaccine status and remain prepared to resume testing if needed. I think we'll move on next to other communicable diseases, respiratory illnesses. At this time of the year, we're soon going to be in the flu season. We should note that Australia had a very challenging influenza season this year. We want to remind people that flu vaccines are recommended for everyone older than 6 months old. With the new COVID boosters available, we want to encourage everyone to get both the COVID bivalent booster and also the influenza booster, and that can be through your provider, the pharmacy, or through the Department of Public Health. These vaccines can be administered at the same appointment at the same time. This is not a stress to the immune system and has no increased side effects and no decrease in efficacy. So now we're going to move on to another respiratory illness. What physicians understand are rhinovirus and enterovirus are usually relatively benign, causing colds or sometimes stomach flu, but there is a new variant available or around at this point, an enterovirus EVD68. And this year it has had some very severe complications, including limb weakness, which is called acute flaccid myelitis, AFM. If any child is showing any recent acute weakness, take the child to the emergency room or your provider for those symptoms. This can progress to weakness all the way up to the respiratory muscles and can cause respiratory failure. So it's important to make those diagnoses and check to see what is the cause, because as we talked about last time, polio has made a little bit of a comeback in the unvaccinated people in New York City, with one case being decided, and it's a little bit difficult. It's challenging to discern whether this is AFM or whether it's polio. But in either case, the child needs good support and to be sure that they don't go into respiratory failure. So putting all of this together, all of the advice for avoiding COVID, influenza, and other respiratory illnesses, the current recommendations include, and let's go to the next slide, it makes it a little bit simpler. Be sure to vaccinate and boost. Stay home when you're sick, and if you're sick, avoid other people. Use masks indoors, when it's appropriate, when you're in public places, or if, for example, you have family members who are vulnerable. and consider wearing a mask around other people if they have respiratory symptoms. The N95 masks are also protective against the flu as well as COVID, and they're protective against environmental threats such as air pollution and fires. So we want people to take individual responsibilities at this time, even though the state has rescinded its rules around routine testing. We want people to know that to protect themselves, masks are still very important. And then be sure to cover coughs, wash hands, avoid touching your face if your hands are not washed. The other thing that we want to encourage those of you who live with a child with asthma or who have asthma yourself, make sure you have an up-to-date asthma action plan. You may need an inhaler at different times, and we want to make sure that you have gotten that from your provider. And then again, as I said before, if your child has trouble breathing or has a sudden onset of limb weakness, be sure to go to your provider or the emergency room for that. I'm going to move on at this point to some environmental issues. We did have an earthquake outside of Santa Rosa on Tuesday. It was 4.4. Luckily, not a lot of damage or injuries came from that, but it's a reminder that we do have earthquakes in our area. And so we want to make sure our go bags are ready, and you can get in touch or get online with mendoready.org to stay informed and prepared. We're also dealing with fires in the state. The mosquito fire is still growing. Hopefully with some rain this weekend, it may be brought down some, but we still are concerned about fires in our area. There's been a 1,000-year drought, and the potential for more fires is great, as well as because of the heat wave, potential for power outages. So make use of that mendoready.org to stay aware of what's going on. In summary, we have various health threats, but we have pulled together as a community, and hopefully we should be able to enjoy a cooler, healthier fall. I recommend lots of exercise to build back our bodies, minds, and spirits. I'm personally hoping to get some cycling in, and when the water returns, to get into my kayak and lose some weight. So moving on, I want to let people know that September is Suicide Awareness and Prevention Month. And in Mendocino County, this is a very significant cause of death. So we welcome Director of our Behavioral Health and Recovery Services, Dr. Janine Miller, to join us for a brief presentation. And I think she also has with her Karen Lovato from that same department. So I'll turn it over to Dr. Miller.
All right. Good afternoon. Thank you, Dr. Coren, for the introduction. And yes, September is Suicide Prevention and Awareness Month, and it is a month every year that we take recognition of, both by doing a lot of outreach within our community and definitely doing a Board of Supervisors proclamation. Some stuff that's really important for us when we talk about suicide prevention, it's a time for us to raise awareness of the stigma and often taboo topic suicide is. We don't talk about it as within families or friends because it has so stigmatized and such a taboo topic. So we really are trying to focus on changing the stigma and hoping that people get more comfortable with the topic and are able to, one, talk about it and ask those important questions if they think they have a friend or loved one who might be suicidal. We really try to use this month to shift public perception, spread hope, and really share the information. We want to make sure people realize that suicide is within our community. It's impacting our loved ones and friends. And it's really important that we know the signs and how to ask that question. Suicidal thoughts can affect anyone regardless of age, gender, or background. So it affects everybody. Sometimes we don't realize how that suicide can affect any one of us. We think it's only those who have a mental health issue or we categorize it in a way. And the reality is it can impact any of us at any time. There's an estimated 703,000 people that take their lives yearly, and that's across the world. And for every suicide, there are likely 20 other people making suicide attempts or having thoughts of suicide, a suicidal attempt. We know that suicide counts for 1 of every 100 deaths globally, and we know in the United States about 41,000 individuals die each year by suicide. We know that oftentimes people don't realize, that are thinking about suicide, the impact on their loved ones. They often think that their loved ones will be better off, but we know that that's not true, and that it actually leaves your family and friend members to navigate the tragedy of the loss, and actually makes it very hard on them. Some of the stats that we always look at and follow as we try to figure out how to do better education awareness in our communities. We know that we have a higher number of men that commit suicide than females, although we know that women are more likely to have a suicide attempt. Men are 4 times more likely to die by suicide due to the method. We know that suicide is the second leading cause of death among people ages 10 to 14, and the 3rd leading cause of death for individuals between the ages of 15 and 24. And suicide is the 10th leading cause of death among adults. We also are seeing far too many service members, veterans, and law enforcement officials take their own lives or consider committing suicide, and we're seeing more in that every day. We want to remind everybody that we do have a new suicide and crisis lifeline. It's a very easy number to remember. It is 988. If you dial 988, it will get you to a crisis center that will make sure you get access to your local community needs. I'm going to hand it over to Karen Lovato, who is our Senior Program Manager and oversees a lot of our suicide prevention outreach. And we'll talk a little bit about what we're doing for the month of September and some of the Know the Sign campaigns for individuals to learn more about.
So we have some slides that demonstrate some of our calendar of events. Mendocino County Behavioral Health and Recovery Services has been doing what we call our Suicide Prevention Storyboard Tour for about a decade now. And what our Suicide Prevention Storyboard Tour has been historically was a collection of stories and visual representations of those whose lives have been touched by suicide in some way, who submitted their graphic, their image, their song lyrics, collage, whatever it may be that they wanted to share with us about their experiences. And we would put them up in trifold and bring them to various communities throughout Mendocino County with a presentation on suicide prevention, risk factors for suicide, and resources and support systems in our community for folks to reach out to. Obviously, we had to scale our suicide prevention storyboard tour down during the height of the COVID pandemic. And so during the past few years, our Suicide Prevention Week activities have been virtual. September 10th is World Suicide Prevention Awareness Day. That's recognized around the world. And the week of September 10th is honored as Suicide Prevention Week. So typically our activities have been held around the week of September 10th. This year, and if you want to go ahead and pop up the slides for folks to see and go to the calendar page, we have been working with a Native Connections Group, which is a coalition of tribal members, to really increase our resources and our activities for Suicide Prevention Month. And we decided to do activities to raise awareness for suicide prevention and suicide resources, prevention resources, support resources throughout the entirety of the month. And so I guess I'll just go ahead and share this here. And so hopefully that is visible there. But we have the activities that will be happening throughout the week and throughout the month, excuse me. And one of the activities that will be happening tomorrow, and that we also did last week in Ukiah, tomorrow will be at the Fort Bragg City Hall, is a Candlelight Vigil. And what we're doing for the Candlelight Vigil is we have taken a luminaria bag for every individual who's died by suicide in the past 8 years. And we've represented them in the different colors of teal and purple, representing the men and women who've died by suicide each year for the past 8 years. And it's a pretty powerful representation We're doing these at dusk. It's from 7 to 9 p.m. Just really giving individuals in the community an opportunity to honor those that they may know who've died by suicide, to honor those who've been struggling with suicidal thought, maybe those who feel isolated and don't realize how many individuals in our community whose lives have been touched by suicide, and to really come together with others. There's an opportunity at the event, your own, and add it to what we're calling a pathway of healing, of speaking up about suicide risk factors, suicide awareness, and making sure that those who are potentially going through feelings of isolation and loss of hope and contemplating suicide know that there's others out in the community who they can talk to, who can support them, etc. So we have a number of activities throughout the month, something every week. Today, there's a wellness fair going on at the Ukiah Conference Center. As I mentioned, we'll be doing the Candlelight Vigil again tomorrow in Fort Bragg. Next week, we have a memorial project for those who died in the state hospital at Mendocino. We'll be watching a video put on by Disability Rights California, a webinar, and then we'll take a walk over to the Ukiah Cemetery to honor the individuals who died in Mendocino County. Tribal Health has an open house at their behavioral health next week as well. And finally, there's a suicide awareness walk that will be at Alex Thomas Plaza next Saturday, in which the Luminaria bags will also be present for the pathway for healing as individuals walk around the plaza, recognizing and honoring those who are struggling with suicidal thought, suicidal ideation, and those who we've lost to death by suicide. One of the most important things to remember when talking about suicide is that suicide is preventable. There's a Know the Signs campaign that really talks about 3 key things. It's important to know the signs that are the risk factors for suicide risk. It's important to ask the question, to actually say the words. Are you feeling suicidal? Are you having suicidal thoughts? Are you planning to end your life? To really use that S word and to not stigmatize it and to not hide from it, as Janine mentioned. Asking the question isn't going to be planting a seed to somebody who's already having thoughts of suicide. It's going to cause relief for them and give them the opportunity to talk to you and know that you're a safe person to talk to about the emotions that they're feeling, potentially the isolation that they're experiencing. Once you have asked the question and know that someone is experiencing thoughts of suicide, it's important to be very real in your emotional response and to help connect the person to the resources that are available. Sometimes you may be that resource. Just being someone that they can talk to, someone that's a safe person, may be enough for the individual to not feel as isolated, for them to feel that sense of connection and that hope to overcome that sense of isolation that they may be experiencing. But if you're not enough of a resource and they need additional professional help, there's a number of resources that we want to make sure that folks are getting connected to, and different resources may be appropriate for different folks. So it's really important to have that conversation, ask that question, have that conversation about developing a safety plan and connecting to appropriate resources. And critical in all of this is really showing the person that they care. Some of the biggest risk factors are an individual feeling hopeless, desperate, trapped, isolated. Mendocino County has a higher rate of suicide than California as a whole, and part of that does have a lot to do with the fact that we are isolated. So when you are concerned about someone, some of the signs that you're going to want to look for are someone who's feeling isolated, desperate, having sudden changes in sleep patterns, mood, expression of their mood, things that are dramatically different than they have been most of the time that you've known the person. Any kind of isolation compounds that sense of isolation, that sense of hopelessness and purposelessness. Any kind of increase in reckless behavior, a loss of sense of value in life, increased alcohol or drug use, again, changes in sleep patterns, or putting affairs in order, starting to give things away, making sure that children or pets are taken care of. Those are all significant risk factors and reasons to ask that question. Ask that person, are you feeling suicidal? Are you having thoughts of suicide? How can I help? Let's talk about this. How can we get you help? Again, asking the question, it's so important to use the S word to make sure that you are asking very specifically. It is a different question to ask if someone is feeling like harming themselves. It's important to listen to the response, validate the emotions, and be genuine in your response. It's also important to connect to those resources and to make a safety plan to make sure that the person, through your conversation, has found some hope to get through this moment, this day, the next day, and the next several days, and that they have the resources to support them in doing that. Some of the best suicide resources and the most easily accessible resources that we have available, I have up here on the slide. Obviously, in our local community, Redwood Community Crisis Center is the most immediate crisis center. There's also the North Bay Suicide Prevention, which is a local Bay Area connection to the National Suicide Prevention Hotline, but they connect with us and work with us quite regularly at Behavioral Health to make sure that they have our most local resources to refer someone when a more immediate intervention is not necessary. There's also very targeted hotlines for LGBTQ youth, veterans, seniors, and other online resources and texting resources available if that's more comfortable for the individual. Again, talking to the individual, making sure that they feel connection, making sure that they have some hope for the future and reaching out for help. And again, at the end of the day, if there's immediate life-threatening risk, immediate medical risk, the most pressing resource is going to be 911. But to the extent that that's not necessary, you want to connect the person to those supporting resources and to really be that ear, that listening, caring person to help that person overcome their sense of isolation. I'm going to leave these resources up here for you to take a look at and make sure to jot down. There's a number of additional resources out there in the world, but these are some of the ones that we refer to most frequently. And I think now we move on to a period of opportunity for questions, unless Janine, you had anything else to close with. No, okay.
Okay, well, thank you, Karen, Dr. Miller, and Dr. Coren. That was a lot of information. We've touched on COVID, Mpox, suicide awareness. So hopefully we can kind of zoom in and reiterate some of these important points with questions from the public. So we actually have a number. Let me just pull them up here.
You know, before you go on to questions from the public, I would just like to say that and emphasize what our behavioral health experts have said. It doesn't matter what phase of life or anything else that people are at. People are vulnerable. My grandfather actually committed suicide, and I wasn't around, of course, but it was during the Depression. And I think when there are changes, during recessions and depressions, and people lose their belongings, their jobs, and so on and so forth, it's very, very high risk, and it very much depends on people who are around them to give them support. And I can tell you that the consequences were that it definitely affected my father. And actually I had a brother who was very severely affected by depression. And I'm not so sure that it was directly caused, but it was a lot of misunderstanding. So suicide is real. It can affect people in whatever walks of life. And I think when the social determinants of health, people are just boxed in with not enough resources, there is more of a tendency, and we need to reach out and help those people.
Thank you for sharing that, Dr. Coren. I'm so sorry. Thank you.
Well, let's jump into some questions then. Looks like the first one for Dr. Coren, that is, short one. Is COVID going to be with us forever now?
Well, I don't have a crystal ball, but I depend on a lot of people in public health at the state and the federal level. And they pretty much are saying, yes, COVID probably will be with us forever, but that we are developing the defenses within our entire population with immunity. And we are doing a lot more testing so that we'll be aware of any variants that are more threatening to us. But COVID as a virus will probably be with us. And just like we have many other viruses that are not such a threat to our society. Okay.
Next question for Dr. Miller or Karen. This was asking about, if an overdose happens, how can you be sure if it's accidental or a suicide?
So we don't make that determination, obviously. That's something that the coroner's office will make, or if the person survives, it's usually a conversation with the individual to ask them, was it accidental or was it intentional? On most cases, if the person does not survive the overdose, the coroner makes a determination, and that's based on if a note is left behind, anything that might be left behind that might indicate a suicide or information that may have been relayed to family members. So if the person's passed, it's really dependent on the coroner to make the determination. If the person survives, we usually ask that question. And we always include family members and get history, because sometimes people aren't always honest when they've made a suicide attempt. So a lot of it is a fact finding.
Thanks for the clarification there. And it looks like one more question for you, Dr. Miller or Karen. Do we know the average age of the suicide in Mendocino County?
We do. I can try to pull that up. If you give me a few seconds, I can try to pull that up. If Cameron, if there's some other questions, I can try to grab that. And I'm assuming, are you wanting suicide attempts or actual suicides? That's a very different number. I may not have the evidence on me as easily.
It looks like the person was asking for people that actually did commit suicide, not the attempts.
Okay, let me see if I can pull my stats. I may have that actual number. Give me a second.
Okay, well, let me find some questions for Dr. Coren then. Oh, here we go. So given that this new COVID booster is brand new and the flu shot's new every year, how can we be sure that they're safe if they haven't been tested together?
Oh, they have been tested, and the slight differences that we make to adjust these, remember, are they are tested together. But the other thing is that with vaccinations, we're giving just a tiny amount of active, you might call it medicine, anything that would interact with the body, compared to a medicine, which is going to be the active component of an injection. A vaccine is a very small introduction to the body to show them what bad things are out there, and the body itself is making the medicine, the antibodies, to fight it. And so through many, many years and many, many trials, initially when vaccines were young, we tested them, and we're very cautious about spreading them out. And we have found through many decades of giving vaccines that these things don't interact. In fact, there are very few vaccines that we avoid giving at the same time or within a few days. With live virus vaccines, we generally want them actually to be given on the same day. It is safer and more effective. And so if there's a delay, for example, a parent comes in and says, well, you can give this vaccine, but I want to spread it all out and not, give the child too many vaccines at the same time. It turns out that if it's a live vaccine, you have to wait 2 weeks before giving another live vaccine. So we've learned an awful lot about vaccines and their interactions and their safety. And it turns out that the COVID vaccines have proven to be among the safest vaccines as well as the most effective. So we know from experience.
Thank you, Dr. Coren. And let's see, it looks like one more question for you about treatments. Someone's saying, my friend got COVID and they got the treatment shot, Paxlovid. They got better and then they got worse again. So is this normal? And are the treatments actually effective?
That's a great question. And actually, yes, the treatments are very effective. Whether a person has COVID and does not get the Paxlovid, or if they get COVID and they get the Paxlovid, there's the same incidence of rebound, is what we're calling it, rebound. And so people will get better, and then, a few days or a few weeks later, they'll get the infection again. Generally, the second infection is milder. We still treat it as the first infection, with the exception that we would not give Paxlovid again. So the short answer is it's not because of the Paxlovid. It's a characteristic of the COVID illness itself that a certain percentage get rebound, and that happens with or without Paxlovid. What's good news is that for the vast majority of people, getting the Paxlovid decreases the time of their illness and their infectivity, and it may actually decrease the likelihood of them developing long COVID symptoms.
Okay, thank you for clarifying. Dr. Miller, did you find any of that data we were talking about?
I'm trying to pull it up, Cameron. It's my computer's like on slow mode.
Okay, oh, no worries. Let's see if we can get some more questions in here then. Okay. So someone's asking about trying to find a counselor or a therapist in Mendocino County, and they're having trouble finding one that will accept new patients. So they're asking, what can I do? for Karen or Dr. Miller?
So it depends on insurance. So the way mental health services work and the way therapy works is it's based on your insurance provider. Even the county system is an insurance provider. And I know that gets confusing at times, but we're not a system that serves everybody, the county. We actually are only supposed to serve by our agreement with the state of California are individuals that have Medi-Cal and meet the criteria for seriously mentally ill. So what we suggest is if an individual works with their current insurance provider, so if they have veterans, you want to work through the veterans. If you have private insurance, you need to work with your private insurance company to see, are there providers locally that are accepting? Can they refer you? A lot of what we're seeing now in both the private insurance world and sort of everywhere is a move towards telehealth being an option. If an individual is willing to do telehealth, there's a lot more opportunities that we're seeing through private insurance, Medi-Cal, different insurance companies. So it really is, they've got to go through their insurance provider and ask, hey, I need a provider. Who can you refer me to? I need someone who's has availability. In the Medi-Cal world, as I said, it's sort of separated. So if you have someone who needs a therapist that meets the criteria for seriously mentally ill, they would go through the county system. They could use the access line or walk into any of our local providers. We always have services available, so we don't get to say we're not accepting. So hopefully that would never be something you experience through the special mental health system. For mild to moderate, if you have Medi-Cal and you're more on what the state looks at as mild to moderate, not meeting the criteria for serious mental illness, you should be working with Beacon, which is partnership, sort of partner to find services. They should be able to find you a local provider and refer you to someone who's currently accepting clients. And like I said, we are seeing a lot more opportunities for telehealth, which has expanded availability for services within our community.
Thank you, Dr. Miller. It looks like we have one more for Dr. Coren about COVID again. This one asking about if I have a newborn less than 6 months, what's the best way to protect them from COVID because they cannot get a vaccine?
That's an excellent question. So for sure, if you have a choice and can stay away from people who are sick, you want to do that. You want to be sure that people who come into your home, including yourselves, are vaccinated and boosted. You're the main contact for that individual. And a lot of times people, when their children are even that age, will go out with a child. And in that case, we can't really put a mask on a child that young. But I think you should, use your judgment about whether the child should go in a crowded public area, because they may be susceptible to someone who be more than passes by. But so if you're going to a restaurant or something like that, where you're sitting for a while and you're among a lot of people, there's a higher risk. So you may not be able to completely avoid it, but you make decisions to lower your risk of harm. And again, that has to do with getting yourself and your family vaccinated. The people who come into the home, see if they're vaccinated and boosted, or if they've been tested, or if they're sick. For sure, if people are sick, they shouldn't be around children, babies like that, because the babies are more susceptible. Oh, the other thing I should mention, how old did you say that baby was? Example?
Let me see.
6 weeks?
Oh, it's 8 weeks.
8 weeks. So that's still a time where nursing is possible, and nursing will also impart to the baby some immunity. And we encourage every woman who is planning to get pregnant, who is pregnant or has just finished pregnant, to get their vaccines and their boosters. So we have proven that is very safe, in fact, much safer than trying to live through all this without vaccinations. There's been a lot of question about that in the past. The research has shown without a question, and we want to encourage any woman who's expecting or trying to get pregnant to get vaccinated. And that very much helps the babies.
Okay, thank you, Dr. Coren. And looks like one final question here for our behavioral health side, asking about if I have private insurance and a teenage daughter less than 18, what's the best way to connect with a provider or support for a teenager?
So there's a couple of things. If you have private insurance, of course, connecting with your private insurance company to see what options they offer for mental health treatment. There has been a movement for some legislation recently that passed regarding parity, which actually means private insurance companies have to start providing the same level of mental health treatment as the Medi-Cal providers, which we should see an increase in services available. And that's the intention of the Parity Act, right, is to really not allow private insurance companies to limit what you have rights to access mental health treatment, which we have seen happening for decades. So really working with your healthcare provider to see what services you are available to you for your teenager. I always recommend that you get recommendations for 2 or 3 therapists, especially when you have a teenager, because sometimes the first therapist just isn't the right choice. Sometimes it does take a teen seeing 2 or 3 to determine that that's the right therapist for them. And that's, I think it's okay to go to a therapist and in the first meeting say, I didn't connect. If your teen doesn't connect, they're probably not going to connect. And you really want a therapist your teen can connect with if you want therapy to be really beneficial. So rapport is so important in therapy, not only for teens, for all of us. But if they're local, the Arbor does a lot of great teen resources. So that is open to everybody. The Arbor Youth Resource Center here in Ukiah, they have a lot of great connections, a lot of great resources. So if you're local, that's also a great option for teens.
Thanks, Dr. Miller. And did we be able to find that suicide age statistic?
So unfortunately, I can't open my current one. I'm sorry, for some reason,
okay.
Being remote is not allowing me to access, but we do know that, and we do have the data from 2020, and the average age was about 52 in 2020. So we're able to pull that data at the moment.
Okay, and I'll just put a pitch in here. If anyone wants to request specific data, you can always get in touch with callcenter@mendocinocounty.org, and then we can always forward once we find the exact data that you're looking for. So that's callcenter@mendocinocounty.org. We're happy to connect there. Let's see, we've got about 10 minutes. Let me find another question if possible. Okay, one more for Dr. Coren, and then I think we're about done here. So someone was vaccinated and then they got pregnant and is saying, if I have a newborn, can I immediately continue breastfeeding? Or would it be too much? Actually, I'm not sure if I understand the question. Would it be too much vaccine for the baby, or should I pump and dump for the day? Dr. Coren, does that make any sense to you?
It sounds like the person delivers and then gets a vaccine after the delivery. Is that what's said?
Oh, looks like they were vaccinated before they were pregnant.
So
can they continue breastfeeding as normal?
Yes. So it's encouraged to get vaccinated before pregnancy, during pregnancy, or shortly after pregnancy. But certainly if you're vaccinated, we want you to nurse, just like we want every woman to nurse if it's at all possible. And in that situation, your antibodies help protect the baby. So the answer is yes, you can definitely continue breastfeeding. There's no reason to pump or to sequester any milk. Even if you just got the vaccine, there's no evidence that it's going to harm the baby.
Okay, thank you, Dr. Coren. And I'm not seeing any more questions at this point. So I think, Dr. Coren, if you have any closing comments, I can hand it back to you. Otherwise, we can do our conclusion.
Yeah, I just, first of all, thank you both from our behavioral health and substance use department. This is, the area of suicide is one that's very important. All of mental health is. And so very appreciative of raising our consciousness and giving us the resources to address it and bring those numbers down and save more loved ones in our community. As far as the other conditions that we've talked about today, I will say we've gone through a heck of a lot in the last 2 years, and we're still facing a number. But what we have done in the last 2 years has really pulled us together greater as a community. Yes, we have some of our differences and they come out, but I think we now have the forums to talk about them, to communicate, to educate, and fight these threats as they come. And I'm very appreciative of everybody's attendance at these meetings.
All right, and Dr. Miller, are there any concluding or summarizing comments you want to do?
I would just simply remind everyone, as Karen did, know the signs. You know, suicide is prevalent. We need to be comfortable with the topic. I know a lot of us probably have lost somebody or had someone with a suicide attempt. It's not easy, but I will tell you, you have to know the signs and ask the questions. So that's my big message to the community, would be know the signs, ask the question. You know, Karen noted it as the S word because that's how kind of the campaign knows it. But we have to be okay with the word suicide, and we have to be okay with asking the question, are you suicidal? Have you had thoughts of committing suicide? And one of the big things we are trying to remove, and there I said it, is commit, right? We don't want to talk about people committing suicide because years ago it was a criminal terminology. It was you were arrested if you attempted suicide. So we really are trying to change the stigma with that too. Someone passes by suicide, right? Or they had a suicide attempt. So it's all of us. I think it's to our community to make a difference. And it takes a village or a community to make the change. And so it's every one of us that has to get comfortable with speaking about suicide and asking the S word, are you suicidal? Thank you.
Thank you, Dr. Miller, and also Karen, our special guest from Behavioral Health. And of course, Dr. Coren, thank you for all your updates, and to everyone that listened and asked questions, big thank you from Public Health. So we'll continue with the third Friday Public Health media updates. So that means the next one is going to be Friday, October 21st, 2 p.m. In the meantime, you can look for updates on Public Health's Facebook page. You can call the call center at 707-472-2759, or also email, like we said earlier. It's callcenter@mendocinocounty.org. So a lot of ways to get updated and stay in touch. And we will see you next month. Have a great weekend. Thank you.
Thanks, everyone.
Thank you.